Hello, happy Tuesday night. This is week 2 of our anatomy lesson. Last week we discussed the lobes of the brain. This week we're going to start off with the cranium, so the bones of the cranium. There are 8 main ones. We're going to go over those tonight, okay? Those include frontal bone, 2 parietals, 2 temporals, an occipital, a sphenoid, and an ethmoid. Okay, those are the 6 we're going to go over tonight. Okay, let's do a little introduction. Did you know that there are 22 bones that comprise the human skull, 8 of which are cranial bones? These bones are immovable joints known as sutures. Now, when you're first born, you have these little openings at the top of your head. Those are where your sutures are. They are not quite developed yet, and they close over time, okay? Sutures. And what the sutures do is they hold the skull together. So when you're first born, your bones in your skull aren't together yet, okay? They form a strong protective enclosure for the brain, which also provide attachment points for muscles and supporting sensory organs such as the eyes and the ears. Number 1, frontal bone up here. Just like our frontal lobe of our brain, we have a frontal bone that protects the lobe. It forms the forehead and the upper part of the eye socket. Here, if you feel your bone around here, it's the one at the top, okay? It's called the orbit or the eye socket. It also houses the frontal sinuses. We have sinuses here, here, here. We'll discuss those at a later class. But today, just know that frontal sinus lives right behind here, okay? Which also reduces the weight of the skull. So once again, the frontal bone forms the forehead and upper part of the eye socket or orbits. It also houses the frontal sinuses, which help reduce the weight of the skull. The next one, parietal bones. Bones as in 2, 1 on each side. Let's see what they do. There are 2 parietal bones, 1 on each side of the skull. They form the roof and the sides of the cranium and articulate, which means join, with each other at the sagittal suture. So you have sagittal sutures, sagittal meaning the side, okay? So the parietals join each other, the sagittal sutures. Next, temporal bones. Bones as in more than 1, 2. If you remember from last week, the temporal lobe houses, partly, with the hearing centers. Temporal bones, okay, house the temporal lobe. Temporal bones are situated on each side of the skull, around your ears. They house the structures of the inner and middle ear and provide attachment points for several muscles, including those involved in chewing, your jaw, okay? It's going to be also located in your temporal bones. Next is the occipital bone. Remember from last week, the occipital lobe is in the back, so it has to have a bone to protect it, correct? That is your occipital bone. The occipital bone forms the back and the base of the skull. It contains what's called the foramen magnum, which means big, a large opening large opening through which the spinal cord passes and connects the brain to the spinal cord. Next is a sphenoid bone. You have sphenoid bone. The sphenoid bone is often referred to as the keystone of the cranial bones because it forms a central wedge-shaped block in the base of the skull, which houses the pituitary gland and contains several foramina or openings through which the nerves and the blood vessels pass. Okay, so in the sphenoid bone, you have several more little openings where your blood vessels go from your heart up to your brain. Okay, provides your nerves to your head, neck, is also your blood vessels. Okay, next is the ethmoid bone. The ethmoid bone is located in front of the sphenoid bone and forms parts of the nasal cavity and the medial wall, medial meaning inside, of the orbits. Okay, I'll take my glasses off again. This is lateral on the side. Medial is on the end toward the inside. Okay, so the ethmoid bone, each one ethmoid, helps make the bottom part and inner part of the nasal cavity. Some people think that the nasal bone is this whole thing, which is not true. Your nasal bone is a very, very small bone that lives right up here. All of this in your nose is just cartilage, okay? So the ethmoid bone is located in front of the sphenoid bone and forms part of the nasal cavity and the medial wall of the orbits. It contains numerous thin, scroll-like structures called nasal concha that helps humidify and filter air as it passes through the nasal cavity. Okay? Let's talk a little bit about the clinical significance of these. Okay? Clinical significance is understanding the anatomy of the cranial bones is crucial in various parts of healthcare. Various medical fields, healthcare, trauma to the head can result in fractures of the cranial bones. You might have fractured your skull before, had someone that you know fractured your skull before. That is what can happen when you fracture your cranial bones. It can lead to potentially life-threatening injuries such as intracranial bleeding. If you fall, hit your head in a car accident, anything like that, and they say you have a bleeding on your brain, it's because more than likely, not every single time, but you have fractured your skull. It's led to bruising of the brain, bleeding of the brain, that sort of thing, okay? And or intracranial bleeding or brain damage. Additionally, abnormalities or malformations of the cranial bones can occur, affecting brain development and function. Before I leave you today, I'm going to show you two pictures of the cranial bones. One will be a frontal, which means I'm looking at you, you're looking at me, image. And the other one will be from the side, called a sagittal view, lateral view, side view. So I'm going to show you those last two before we close this lesson. You might have to adjust your camera and turn it, flip it, So it will be the right side because mine might appear backwards on the video. Let me just find this last piece of paper. Here we go. This is the frontal view right here that has all of the bones. I hope you can see it clearly. I just had to make a copy. But as you can see, you have all the cranial bones listed there. Ethmoid, sphenoid, parietal, frontal. You'll notice right here, that's your mandible. That's where you chew. And so that temporal comes out here. Your ears will be over here. Okay, sphenoid, ethmoid, nasal. See, your nasal bone is very, very small. It's not this whole bridge of the nose. It's just this. Can y'all see that? You might have to, like I said, flip your image. And we'll go over some more next week. The zygoma, or kind of your cheeks, right there. Zygomatic arches. We'll go over a few more next week. That's the frontal view. And lastly, before we close, here is a side view. So frontal, right there. Ethmoid, sphenoid, there's the orbit. There's your nasal bone right there, very small. Your occipital, the very back. Temporal, going to where the ears are. Parietal is up here. Parietal is between the frontal and the occipital. Temporal and parietal are kind of on the side. Okay, and of course there's your mandible again. Mandible and maxilla. Those are the other two bones. Maxilla making up the roof of your teeth. Right here. The bottom is the mandible. That's the other two of the 8. The maxilla's here. That's where your teeth, upper teeth, are located. And the mandible down here is where your lower teeth are. Mandible, maxilla. Here's another view. Get it up here for you. Your maxilla there, and your mandible there. That helps you to chew, talk, any kind of movement. If you put your finger on your ears here, you can feel that you're part of your mandible here. Okay, there's the point of your mandible. But your ears, people talk about having TMJ syndrome. It's because your skull is articulating with your mandible, just like this, like that, okay? So I hope you enjoyed this lesson. If you have any questions, leave me a comment. Be happy to answer. Until next time, next Tuesday, have a good night, and I will see you soon. Bye-bye.